Welcome to the press briefing. On stage, we have Dr. Albert Au, Principal Medical and Health Officer from Center for Health Protection, and Dr. Larry Lee, Chief Manager from Hospital Authority. Dr. Au will give us an update of the number of cases. Fellow citizens, friends from the media, good afternoon. I'd like to report to you the number of cases received by Center for Health Protection yesterday on the 1st of May. Yesterday, we had 120 confirmed cases through PCR. 22 were reported or confirmed by Hospital Authority, 22 by the Public Health Laboratory of CHP, and the remaining 76 cases confirmed by private labs. As regards RAT, yesterday there were 163 positive cases reported to us and confirmed on the platform. Yesterday, we had a total of 283 positive cases. In the fifth wave, so far, Hong Kong has confirmed 1.19 million, 2,162 cases, 764,149 confirmed through PCR, and 446,013 cases confirmed by RAT. For cases confirmed yesterday, 11 were imported. The remaining 272 were local cases. Among the 11 imported cases, 6 were detected at the specimen collection center at the airport. 2 cases were imported from South Korea on KE607, arriving on the 30th of April. 2 from Singapore. 1 arriving on the 1st of May on SQ882 and SQ894 respectively. We have 1 from Taiwan arriving on the 1st of May on CI909 and 1 on the 1st of May on MA072 from Malaysia. Now for the remaining imported cases, 4 were confirmed at Quarantine Hotel. 1 on day 5 through PCR from India. Another on day 3 through RAT from the UK. And 2 on day 4 also are detected using RAT from Canada and Italy respectively. And the remaining 1 on day 12 at a community testing center from Thailand. For genome analysis yesterday, the Public Health Laboratory did genome analysis on 77 cases. No L452R samples were found. 16 were confirmed negative to L452R, and the remaining 2 samples, viral load was too low. As for care homes, we did not have any cases from care homes which had no cases previously. There was 1 elderly care home with 1 case, with also previous cases involving 1 employee. For schools, because yesterday was a holiday, there was no new report from schools. As regards death cases, so far in the 5th wave, we have recorded 9,105 death cases, up 5 compared from yesterday. Death rate 0.76%. For those over 80, the death rate is 10.45% for age distribution, and now also the number of jabs they received very much similar to what was it like yesterday. Now tomorrow, kindergartens, childcare homes will start to resume classes, including secondary schools resuming classes in phases. So most CCCs, KGs, and secondary schools will resume classes tomorrow. So may I remind all parents of young kids to conduct RAT for their children, and if they test positive, they should not go to school, and they should report through the declaratory system. Dr. Lee will report to us the situation with HA. we have 1,294 confirmed cases receiving treatment in different public hospitals, Lanta Hospital, ICC, and HA Infectious Disease Center, and also Treatment Center for COVID AWE. 2 cases were reported critical yesterday. We have no new serious cases reported. 6 critical cases are being treated in ICUs. For the 2 critical cases, 1 do not have any vaccination record. The other has got 2 jabs. 3 cases of death were reported. They passed away yesterday. 2 male, 1 female, aged between 74 and 98. Among the 3, they did not come from care homes. 1 had no vaccination record, 1 2 jabs, and then all of them are over 65 years old. On the 30th of April, 2 patients passed away, were not reported. 1 male, 1 female, aged 78 and 92 respectively. And yesterday, 92 patients recovered. 55 patients were discharged. In the 5th wave, so far, 48,198 patients have recovered. Today, 2 patients tested positive upon admission screening, and 2 patients are listed as close contacts. For staff, 22,504 staff members were confirmed, and 22,101 have returned to their posts. And in general outpatient clinic, for these services, we have been monitoring the situation and adjusted our GOPD services. It seems that as the epidemic eases, there is rising demand for general outpatient services. We're going to resume the service of 10 general outpatient clinics starting from tomorrow, the 3rd of May. The list has been sent to you, and we will also announce through a press release later. We understand that there is a keen demand for general outpatient service. So as the epidemic eases, we're going to resume the operation of some more GOPCs. Now, the 23 designated clinics for COVID will continue to operate to support COVID patients in the community. And we will have attendances reserved for high-risk patients, those who are over 70 or below 5, or people or women with over 28 weeks of gestation, and then for confirmed students, and also family members can call the care line of these designated clinics to make an appointment. Q&A, please use the microphone we pass to you, and please identify the organization you represent.
I'm from Now TV. Tomorrow, kindergartens and secondary schools will resume classes in phases. Do you expect an increase in infections? Some organizations say that it may be difficult to get kindergarten students to do rapid antigen tests. Does the CHP have any advice for parents? From tomorrow onwards, there will be a significant increase in inbound flights arriving in Hong Kong. Now that the government is relaxing the border control restrictions, will that pose risks in terms of outbreaks? The infection numbers have dropped below 300. Can social distancing rules this month in an orderly, safe manner, or can we relax the restrictions even earlier on? Thank you for your questions. For the class resumption tomorrow, from the information from the Education Bureau, there are roughly 1,500 kindergartens, childcare centers, and 400 secondary schools that will see gradual face-to-face resumption of classes. Here's an appeal. Before students go to school, they should do a rapid antigen test. If they test negative, they can go to school. This is done to minimize the risk of transmission at schools. We expect some positive cases will be picked up. That is because we still have hundreds of cases reported every day in the community. That means silent transmission chains still exist in the community. That may affect students as well. Many students will be returning to school, and many schools are involved in this class resumption. So we do expect some cases will be picked up. So we have to manage the risks here. When positive cases are picked up and students refrain from going to school, that will help minimize infection risks and transmission risks at schools. The second question about taking specimens. We understand that for children, especially for children at child care centers or kindergartens, those between age 3 and 5, it will have to rely on the cooperation of the children in terms of the specimen taking. Parents should get prepared. If they have never helped their children take a specimen, they should take a rapid antigen test kit and think ahead about how to proceed with the procedure and explain patiently to the child why and how this will be done. This may take some time in the morning, that is the RT test, so they may have to get up early, make allowances, and they should help the child take the specimen first, the first thing they get up. Now, there is information online from the pediatricians organization. It's a guideline about how to do an RT for children. And they can refer to the website for their guidelines. Third, an increase in inbound flights and the relevant risks. If there are more visitors coming to a city, will be a higher risk of bringing in more infections. The government has done a risk assessment. Elsewhere in the world, the COVID situation is easing, infection numbers are dropping. As long as the risks are manageable, even with an increase in inbound flights, we will have the capability to handle the situation with the stringent border control measures such as vaccination requirement and the testing in terms of PCR or RT tests. And then there's also the requirement about the quarantine at the designated hotel. These measures will help ensure that we can identify cases early when we do get imported cases. Now, in terms of relaxing the social distancing rules, the government is closely watching the situation. And through a number of indicators, the government monitors the situation and would decide when and how to relax the rules. Next question, the lady at the back. I'm from Hong Kong 01. Tomorrow, kindergartens, childcare centers, and secondary schools will gradually resume face-to-face classes. How many cases do you expect in terms of the increase? Do you expect the cases to be in single or double digits? What will be the impact for the overall COVID situation? Previously, we saw some new subvariants of the Omicron variant. Would the government consider tightening the whole quarantine requirements, such as lengthening the quarantine period to prevent these new subvariants from finding their way into the community and preventing the risk of a sixth wave of outbreak? Thank you for your questions. The schools and the class resumption tomorrow. The figures from last week suggest 600 or so primary schools resumed face-to-face classes. Every day, 350,000 students and 50,000 teachers did their daily RT tests. In terms of the cases picked up or reported every day, there are roughly 10 cases every day. Tomorrow, secondary schools and kindergartens will also resume classes. More people will be doing tests. There is a chance that we will be able to pick up 10 to 20 cases, but it will be hard to tell specifically how many cases there will be. For kindergarten and secondary school students, it may have been a while since they have done an RT test. Some previous infections may be uncovered tomorrow, so it wouldn't come as a surprise if we pick up more cases tomorrow. So schools should report the infections to us every day so that we will conduct investigation. If we see more cases at schools and anything unusual is found, we will follow up and see what measures can be taken. But tomorrow will be the first day of class resumption for secondary schools and kindergartens and childcare centers. These students haven't been back to school for a while. Now for the quarantine requirements, arrivals have to get tested and go through a quarantine. These are very stringent measures. They have to be vaccinated. Upon arrival, they have to get tested and go to quarantine hotels through designated transport. And at a quarantine hotel, they have to do daily rapid antigen tests, and on day 5, they have to undergo a PCR test. These steps will help pick up cases. The incubation period for the Omicron variant is short. Most cases can be identified within the quarantine period of 7 days. Next question, the gentleman over here. I'm from AM 730. For the imported cases today, for the 6 cases picked up at the airport, do we have any non-Hong Kong residents among them? Or do we have similar figures for those arrived yesterday? And for the Thai person whose infection got picked up on day 12, do you believe this is local infection or is it a real positive cases? Cargo flight crew do not have to undergo quarantine starting from yesterday. How many crew members have applied for this quarantine-free arrangement? Now for the clinics, do you reallocate the manpower from designated COVID clinics to your general outpatient clinics, or will there be any impact on the 23 designated COVID clinics? For the quotas at the designated clinics, will there be fewer quotas because of the resumption of services at GOPC? Do you have any plan for resuming more services at GOPCs in the next step? Now for primary schools, they will get access to the special care line. Will the secondary schools be covered by the class resumption? I'll take the first 2 questions and I will invite Dr. Lee to take the 3rd and 4th questions. The first question, for the confirmed cases, there are 6 were picked up at the airport. I do not have the information at hand as to whether they are Hong Kong residents. For local and non-local residents alike, they can travel to Hong Kong as long as they meet the requirements. For both groups of people, if they have stayed overseas, they pose a similar level of risk. Now for the person who tested positive on day 12 at the community testing center, it's a 45-year-old male. He has been vaccinated. We have done some preliminary epidemiological investigation. On 19th of April, he arrived at Hong Kong from Thailand. There were 3 fellow travelers, his family members, all have been asymptomatic. He's asymptomatic too. He followed the requirements by doing daily rapid antigen tests after arrival. The results came back negative. On day 5, April 23rd, the PCR test came back with a negative result. On April 30th, that is day 12, the PCR test result came back positive. The CT value was roughly 21. This is not a very low, but it's not very high either. We have done some preliminary investigation, which shows that on 1st of May, his rapid antigen test turned positive. We believe this may be a local infection, but we cannot rule out other possibilities. After all, he has a travel history. We will make arrangements for a private contractor to send a specimen to our public lab services branch for genome analysis and genome sequencing to find out whether this is an imported case or a local infection. For now, we classify this as an imported case. For the designated COVID clinics, we have made internal deployment of manpower within our clusters we have this internal procedure. We also allocate manpower accordingly for isolation and quarantine facilities. As the COVID situation eases off, we have been able to resume some services, such as the general outpatient clinic services, but that will not affect the services at the designated COVID clinics. The 23 designated COVID clinics will keep running, and there will be quotas set aside for at-risk persons, and there will be this dedicated care hotline to make reservations. We are aware of that as COVID eases off, there may be an increase in service demand on GOPCs, so we will be gradually resuming more GOPC services, and we will announce the next steps as soon as possible.
Speaker was off mic. I'm sorry, I don't have these figures. The lady in front. I'm from Mingpao. A first case tested positive on day 12. Could there be any risk of spread in the community? Because you still cannot confirm whether it is an imported or local case. And I'd like to know the number of cases tested positive on day 12. Have they all been subject to genome analysis? How many of them were infected locally? Yesterday, that was the start of a new flight suspension mechanism. I'd like to know whether flights have been suspended from coming to Hong Kong. And have you found any new variant or subvariant of Omicron? The government once said that all arrivals will have to do RAT. Now, if they are negative, they can return to the hotel to wait for PCR results. We were told that it would take effect in early May. Do you have an exact commencement date? Thank you. One of the cases confirmed today was tested positive at a community testing center on day 10 or day 12. We can't say whether it is a local or imported case yet, but then it could be a local case because RAT results were negative all along, and on the 1st of May, it was positive. So because he came back from overseas within the past 14 days, so we would count it as an imported case first, pending genome analysis. When the result is available, we can confirm whether it is an imported or local case. If it is an imported case, and it will be a case with a longer incubation period, and we've arranged for him to be isolated at home, and we'll see whether family members are subject to quarantine as well, and we will conduct epidemiological follow-up. Now we have the new flight suspension mechanism, and so far no plane or no flight has been subject to the new mechanism. For the case positive, for cases tested positive on day 12, we have got 13. In April, we have got 13 cases that tested positive after the isolation or quarantine period. Genome analysis confirmed in one case that it was a local case, and that is after the quarantine period, the case was infected in the community, which is not surprising because we still have a lot of cases in the community. So after quarantine, it is possible that a person can be infected in the community. For the remaining 12 cases, they are classified as imported cases. 9 of them, for sure, were positive cases because they record overseas. For the remaining 3 cases, the viral load or the CT value was very high, meaning very low viral load. And the viral load was insufficient for any genome analysis, so we classified them as positive cases. So cases leaving quarantine hotels were either positive cases of course, there was one local case, and for genome analysis, it is done on all positive cases after leaving quarantine hotels. So as I said, there was a one BA.2.120 and another case is BA.2.15. And we've got 5 cases with genome analysis result pending. And for remaining 5, the viral load is too low for any analysis. As for RAT at airport, the relevant colleagues and departments are making preparation and will announce the commencement date when it is available, ASAP. Thank you. The lady at the back. Good afternoon. I'm from TVB. Dr. Au, you said that a case was a local case and tested positive on day 12. Which case are you referring to? And then with the reopening or with the relaxation of inbound traveling, have you seen a surge in the number of cases? And then you said that it may be possible for arrivals to wait for PCR results in hotels, so they are waiting for results at the airport. What is the risk of infection if so many passengers are waiting for the results there? There was a case tested positive on day 12. It was an earlier case and also reported. Passenger arriving on the 29th of March from South Korea. The case tested positive on the 9th of April. With a CT value of 21, and our family members also tested positive. Genome analysis found that the variant was very close to the one prevalent in Hong Kong, so it was regarded as a local case. And as for an RAT at our airport, we are making preparations. When we have firmed up things, we'll announce them as soon as possible. While passengers are arriving at the airport, after registration, they will be subject to testing at our temporary specimen collection center, and we have infection control measures to avoid gathering of these passengers and cross-contamination or infection. If there are no further questions, the press briefing ends here. Thank you very much.